Welcome to the Doctor Lexi Show, where I take pregnancy topics and break them down into simple terms to help you advocate for yourself and your pregnancy. I'm Dr. Lexi, a board-certified OBGYN and maternal fetal medicine specialist, which just means a high-risk pregnancy doctor. And today we have a really special guest on the podcast. So the podcast version of the Doctor Lexi Show is really to take guests that are somewhere within the field of pregnancy, whether it be someone who's gone through a pregnancy or someone who takes care of pregnant individuals. So today we have Dr. Sarah Pachtman. And tell me really quickly though, last name, Pachtman still or no?
Pachtman, plus in some situations I add the Shetty, which is my married name, but it's too complicated to change your medical license.
Yes.
So I just stopped at that paperwork.
Nice. So Sarah Pachtman.
Yeah, that's my professional name.
Professional name.
Yeah.
And can you tell the listeners and me again what it is that you do?
I also am a maternal fetal medicine specialist. I practice obstetrics and high-risk obstetrics and maternal fetal medicine.
Perfect. And where do you live right now?
I live in Long Island City, New York.
Okay.
And it's part of Queens, right in New York City. And I practice in New York City and on Long Island.
Awesome. And usually when I start this, I actually have these questions that I ask guests. I'm not going to do that with you today because for you, they would be boring in a good way.
I like
right?
that. I like that.
You know, what is antenatal testing and can babies have hair in the womb and things like that. So, and fun, true, false questions that you know all the answers to because you are a huge advocate and educator for patients. So I want to jump straight into that.
Awesome.
And kind of just give me some background on, I know you are an MFM. I know you're a high-risk pregnancy doctor. I know that's what you do on your day-to-day, but you kind of have this separate side, which I just got chills thinking about this because just the way in which you help educate people, I know through social media, but I know for sure where you are in your community. What got you into doing that?
Actually, it's a good question. It started out as almost like a COVID passion project because I was seeing so much misinformation around COVID and vaccines, and especially the new mRNA COVID vaccine during COVID. And I'm not joking, be in my ultrasound unit scanning patients who would come in with like that mask that people wear in construction or like the Ghostbuster mask, the big whole thing, and shields and whole body suits. And while I get it at the same time, and it was very scary, COVID in New York City.
Yeah.
Very scary. At the same time, I was like, who told you that this was going to help you? And I had patients wearing like a scuba gear mask.
Oh, and legitimate scuba.
Yes, like a snorkeling mask.
Snorkeling.
That she tripped and fell because she couldn't see.
Yeah.
So I was like, let's start from scratch. Not just because patients were asking questions and I was like, this is clearly just someone told you this and you heard it, old wives' tale, what have you, but also focused around COVID. And it's just like has expanded from there so much.
Wow. Okay, perfect. And then since you mentioned some COVID stuff, just let's talk about that a tiny, tiny bit.
Sure.
COVID vaccines. I think it was a scary time to be pregnant then. Scary time for everyone. But obviously, like I had friends who have a friend who had a history of breast cancer. So she had to save her eggs a long time ago and went through the whole process with that. And then had just ended up getting a surrogate and the surrogate was pregnant. And so she had so many questions, pre-vaccine, like, what do we do? How do we do this? And then when the vaccine came out, there was so little information and then even less information for the pregnant population. So we won't go backwards in time, but for now, when you have people asking like, hey, is it okay for me to get this vaccine and I'm pregnant? Like most people maybe are vaccinated now, but say if they're not, like, how do you talk to them about that?
So first of all, I have a good story, a personal story, because this is something that I'm super passionate about. And I have personal reasons to be also. So I was doing IVF during COVID and I was banking embryos and doing the whole thing. And it was crazy because my clinic was open the whole time, but I had to stop a cycle or couldn't get the meds in time because it was COVID and everything was backed up or you name it, it happened. And I was going to have my first transfer in January 2021, I think it was.
Yeah.
Yes. Right? 2021 or 2022, maybe.
Probably 2021. If it was it pre-vaccine?
It was
or right around when the vaccines came out?
Right around when the vaccines came out. So the vaccine came out in that December for healthcare workers. So that must have been December 2020.
It was December 2020.
Fine.
Because I'll tell you that story later about how I could not get vaccinated but tried to. So go on, please.
So then my transfer was scheduled for a Tuesday and I was ready for it. I was doing the PIO progesterone, which is not fun, and just living my transfer, getting ready life, drinking beet smoothies and whatever. And gross.
Yeah.
That's like way grosser than the vaccine, but here we are. And then they announced that the vaccine was out and healthcare workers were going to get it any minute now. So because we didn't know anything.
Yeah.
My doctor was suggested that I cancel the transfer. I talked to like every MFM I've ever met. Also said, just why are you risking it? Canceled the transfer. And I got the vaccine, delayed a transfer for 3 months. I then went on to have 4 failed ones. So that's a different story. And then got my booster when I was finally 16 weeks pregnant after my 4th transfer later on in the fall, next fall. So
oh my gosh.
I had to, because of that, change my planning.
Yeah.
And then finally we learned enough and we had enough data. Like there's more data now about the COVID vaccine in pregnancy than there is Tylenol or labetalol in pregnancy. Like, let's be real.
True.
So I got it when I got the booster at 16 weeks with my now son, who's 2.5.
Okay. So for someone who literally, I think we are the people that would probably know the most in that field. We would be the people they would come to for questions. So being that person and still having such limited information, how scared were you about getting the vaccine? Just like, how did that feel?
It was scary because I said, I mean, I'm not really afraid of vaccines. I have no issues with them outside, but it's new. And even though the platform's really not new, like mRNA platforms are not actually new, but it's new in vaccine land and new in vaccine world. So it was something different and something we hadn't tried before. So I was like, okay, I'm going to see how this does and see if it's okay. And sure, I'll cancel my transfer. But then I was comfortable enough after all the data we had showing good outcomes that I got it in 16 weeks. And I tell all my patients, if it's COVID season, if there's an uptick, if you hadn't had a booster in a while, if there's a new booster, please get the COVID shot. Like 2024 COVID is different than 2020 COVID or 2021 COVID.
Yeah.
But I just have seen enough badness in the hospital that I just don't want people to get sick with COVID or the flu or anything in pregnancy to make you so sick.
Yeah.
Respiratory viruses are worse.
They're bad. And when you mentioned like COVID season, I remember when COVID started, everyone was asking, do you think this is going to be like the flu where we're going to have, and I'm like, you know what? I think that may be what happens. And obviously it's kind of where we are. Is this something now where it's like, hey, if it's COVID season, every year we feel like there's really going to be a new quote unquote vaccine for each year?
If that ends up being the case, I will recommend it just like I do the flu shot in pregnancy for each year.
Yeah.
Because I don't need there to be one variant of one year that we just don't know yet that is severe again. And have intubated pregnant patients in my ICU.
Scary.
I really don't want that.
And I think people forget, or they don't know, which that's part of, talking about it, is that when people are pregnant, they are considered immunocompromised. I mean, we really like to let people know you can't fight off an infection as well when you're pregnant. And I think, so many people, there are so many joys of pregnancy, which is awesome. But we kind of gloss over, it's a very vulnerable population. So when they get sick, they can get more sick than someone who's not pregnant.
Correct. And scary. People are afraid to take care of pregnant patients.
Especially dentists.
I'm not. You're not.
Dentists don't want to see them. I got to get a dentist on the show and be like, listen, I'm calling you out. Like shield the body like you do and take an x-ray of their face.
Yeah.
Like it's okay.
And give them whatever numbing they need to have whatever teeth cleaning they need.
Yes.
I write my patients notes all the time. You can have any dental procedure that is indicated. Please proceed.
Oh, yes. COVID. I'm going to get back to that one thing. My fun story. I say fun. It's not fun. I had a friend who was pregnant during COVID. So it was like November of 2019. Is that right? No, sorry, November 2020. So she was pregnant, did MFM, just like us, and needed coverage for her clinic. So I moved to Houston, Texas. Shout out Casey. Casey's from Houston.
Hey.
So moved to a large city in a different state from where I live, worked in the office and in the hospitals for a large hospital.
Oof.
Okay. Thanksgiving, Christmas, and New Year's all by myself in a hotel. Peak of COVID, no vaccine until it started to come out at the very end of the year in 2021.
Right.
And when the vaccine came out, I'm like, great, this is important for me. I have a non-ischemic cardiomyopathy. I'm working around a very vulnerable population. I'm in and out of hospital every day, staying in a hotel randomly filled with people, etc. And they wouldn't vaccinate me.
Why?
The hospital said, you need to be vaccinated. It's a mandate. I said, great, vaccinate me. Well, you're not an employee here.
Oh, no. Oh, no. But
you are contracted through another company that we sought you out to help us.
No.
And we will not vaccinate you. Here was my option. Fly back to your state of Arizona, right? Get on a plane.
That's crazy.
Where you've been around all these sick people. Go back there, get vaccinated, come back to Texas. Then in, what was it, a month or two later when you need your next shot or whatever.
Go back again.
Go back again, but you have to get the appointment at the same location, which was impossible at the time anyway. I'm like, I'm not flying back twice. And plus I'm covering a hospital and a clinic 24/7. I can't leave. Yeah, but you have to be vaccinated. Okay, then vaccinate me. But they wouldn't vaccinate me. We went in circles forever. So I remained unvaccinated until after the new year, into January, until I could move back to my home state and get an appointment to be vaccinated as a healthcare worker on the front lines with pregnant patients every day.
That's crazy. That's just so crazy.
I know. But I mean, it was one of those things where I couldn't abandon the patients.
Right.
Right. So I put
you put yourself in danger.
Right.
We do this a lot. But also, you were probably saving your N95 mask and using your N95 mask for like 5 days at a time.
Yeah.
Who knows what?
Very true.
They'd put it under a blue light and disinfect it. What?
It was the weirdest time.
I
have a very prominent nasal bone here, and the masks, the fittings were always difficult. You have to go through fittings and breathe, and they spray the stuff.
Yeah.
So
you're I still smell it.
I still smell it. I want to touch a little bit on burnout, just because I know that the career path in which we've chosen, it took a long time to get here. A lot of studying, a lot of exams, a lot of moving around the country and all that kind of stuff. How do you deal with being a spouse, being a mom, being a doctor, being a teacher, and then, trying to just be yourself amongst all of that? How do you do it?
It's really difficult. It's really hard. I will say that I have times where I'm irritable a lot and anxious a lot because it's like my plate is more full than I would like it to be right now. And there's times when I have to say, all I can do right now is be a spouse, a mom, and a doctor who sees patients. I can't do extra things. Like I'll have to stop my Instagram for a week or two. I'll have to say, no, I really appreciate your invitation to this committee, but I just can't do it. I have to create space and time for myself to exercise and make sure I get my whatever self-care appointments in, because burnout, or whatever the word that we're using for it now, is so real and so strong. And I don't even know. People are like, do you drink Red Bulls? How do you get your energy? I'm like, some half of it's fake, honestly. It's comes from I don't know where, but it's really hard.
Yeah.
It's a lot.
Yeah. Well, I think we're all working on it. I know I am every day, just to kind of keep your head above water. Sometimes the treading that's going on below water, I think that a lot of people don't see it. So trying to almost even verbalize that to people has helped me. Like, hey, like you said, turning stuff down and being able to say no is not a weakness. And I think in our field, so many things, when you don't visibly look like you're about to like have a mental breakdown, people are like, oh, you have so much extra time. I'm going to throw this on you, right?
Right.
It doesn't need to be that way. And I think that making changes, which when I made a change in a job, there was a little bit of the fear from my end of I'm going to be looked at as a quitter.
Mm.
And it was like a shameful thing of like, you don't leave a job that you just don't leave a job, right? Like you keep working and you keep pushing and you stay at one place and you just make it happen. And I don't know, I that shame I felt or whatever went away really quickly when I was like, this isn't my story. I'm not going to be a victim to people being angry at me for choosing to help more patients,
Right.
treat them in a really nice fashion. And oh, by the way, take care of myself from a physical and mental standpoint to be in a great place to continue to provide good care.
Totally.
Right.
It's something that I learned just, maybe this year. It's been a few months into my no journey where I realized, I said, look, everything that I'm saying yes to actually means that I'm saying no to two different other things because I am only one person and I can't physically, mentally, emotionally, because of this thing that's weird, it's a physical thing called time, do all of these things. So I have to say what brings me joy, what is helpful, what is part of my job, what is part of my choice, and do those and not do the other things. And that's okay.
Yep. Absolutely.
And it's so hard to say no because we've been conditioned to say yes, and not quit. But sometimes that's actually the best thing.
Yeah. And it's good, I think. And have you ever heard of Brene Brown?
Yes.
Okay.
And her podcast.
And her,
So yes.
so good. I always,
So good.
I think I've tried this for forever. Like every time I talk with someone about Brene Brown, I'm always like, hi, Brene.
Yeah.
Because
Hey,
one day
listen to us.
that's my like, you know how people used to say, like, if you could meet someone living or dead, like who would those people be or whatever? And
You
she's
would
like,
want Brene Brown.
yeah,
Cool.
her and the Maya Angelou for the,
Yeah.
just those are my two of my favorite peoples, I would say. But I think you hit the nail on the head the way you said it. It makes sense. It resonates. And I like the no journey. That's kind of a cool way to
I'm
put
on a
it
no
too.
journey right now.
I need to start that. I'm going to start that myself.
It's a good thing to do.
It's good. I like it. It's like the movie with Jim Carrey where it's like, yes, man, but it's like, ours is going to be no, man.
Yeah.
No, ma'am. Either one. Fine.
And I'm just like, I just know is a complete sentence and that's it.
Yes. I mean, no. I mean, yes.
Yeah. Totally.
Well, thank you for being here today.
Thank you so much for having me. It was such an honor. And I'm so excited to get to see you and talk with you. It was just amazing.
Thank you. And for anybody listening, if you're wanting any more information on board exams or anything, you can always go to the website, drlexihill.com. And if you're pregnant and wanting any more information on how to advocate for yourself, tons of resources for you on YouTube, on Spotify, all the little fun things, social medias, etc. Can you give us real quick your Instagram handle and all that stuff so that I can send people your direction, please?
Sure, definitely. My Instagram handle is Healthy Mama Doc. It's Healthy MAMA Doc. And I use my platform to entertain and educate and empower pregnant and people who are postpartum and people who want to be pregnant. And I love it. It's my passion project turned passion life.
I love it. It's so fun. Well, thank you guys for listening today. And as always, I'm Dr. Lexi, wishing you a happy and healthy pregnancy.